This is a Mims that you'll generally find in a hospital, within the nurse's station or a treatment room, or on the bottom of a medication trolley. You can also access Mims online or through a Mims annual, which you will find generally in the treatment room. When we're looking in a Mims, the first thing we need to do is identify the medication. So, for example, we're going to look up at heparin. Now you'll find in the index, we go to the index and find the medication heparin, and like all indexes, it's in alphabetical order. So you want HEP. Now what we're looking for here is heparin. So heparin injection PB. So we're going to go to page 88. Once we've found page 88, the first thing we need to look at is the top of the page, and it tells us the family that the drug belongs to. So heparin belongs to anticoagulants and antithrombotics. Now we find the medication within this page where it should be. So here we have heparin for injection, also known as heparin sodium. The use for the medication is anticoagulant, prophylaxis, or treatment for thromboembolic disorders. This can be justified when we look at the medication chart for the indication. Indication, deep vein thrombosis. So therefore, the doctor has written it up for a prophylaxis. We now can look at the contraindications. So in this case, contraindicated could be potential of hemorrhage states. So somebody with haemophilia may be contraindicated, so we would withhold the medication if appropriate or bring it to the doctor's attention if necessary. We also need to look at the precautions. So when we would actually monitor the patient, it may be given, but we need to monitor them. So in this case, somebody that has a history of allergy, obviously not an allergy to heparin, but just a history of allergy in general. So we would need to monitor them. We now look at adverse effects. Adverse effects are commonly known as side effects. So when giving heparin, a side effect can be hemorrhage. So therefore, as an anticoagulant, in general terms, it is a blood thinner. However, as a nurse, you should know it in more detail. So therefore, if it thins the blood, altering the clotting cascade, the patient is not able to clot and can hemorrhage instead, therefore meaning they will bleed. Unfortunately, drugs can interact with each other. So we can give an anticoagulant, such as heparin, but it may actually interact with another drug and making the effect either worse or better. In this case, heparin interacts with non-steroidal anti-inflammatory drugs. So we would have to monitor or withhold and discuss it with the doctor. Now, one of the biggest things you need to consider, along with side effects, is the dose of the medication. As you can see, the dose of the medication, you need to see what the indication is for. So in this case, it's got administered by intermittent IV infusion or deep subcutaneous. In this patient, because it's given as a prophylactic, it's a deep subcutaneous injection. And you can see a post-op prophylaxis should be a dose of 5,000 units, deep subcutaneous, 2 hours before surgery, and repeat every 8 to 12 hours after surgery for 7 days. Knowing that, if the patient was to have 5,000 units every 8 hours, there are 3 8s in 24, means they can have a maximum dose of 5,000 units in 1 day, or a minimum dose of 10,000 units in a day. This is how we read a Mims. For further information, please refer to your tutorial teacher.